Hello, everyone, and welcome to today's industry webinar, CMS Interoperability and Patient Access Final Rule. My name is Ellen Knowles. I am the Marketing Communications Manager here at Azalea Health, and I will serve as your moderator for today's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. All attendees are in listen-only mode. Know that the system defaults to computer audio. If you would prefer to join over the phone, just select telephone and the audio pane on the right-hand side of your screen, and the dial information will be displayed there. You will have the opportunity to submit your questions during today's webinar. We will address them at the end of the presentation. We want to have a very interactive Q&A session, and we encourage you to send in your questions at any time during the presentation. Please keep in mind there are new updates being released weekly and sometimes daily to the ongoing changes during COVID-19. So if you have any questions that we are unable to address during today's session, we can follow up with you separately. Also, please note that today's slides will be shared in a follow-up email along with the webinar recording. I would now like to introduce our presenter today. We have Margaret Chandler, Azalea's Clinical Regulatory Consultant. And with that, I'll go ahead and turn it over to you.
Hello, everyone. Thank you so much for joining our call. Today's topic is the CMS rule for interoperability and patient access. I haven't really heard people talk about this a lot. It came out the end of March, I think the 22nd, and I wanted to talk about it today because it is very impactful to our patients, your patients, our patients, and so I just wanted to kind of start getting the word out there. I hope that the information is helpful for you, that it is as important as it seemed to me. So the reason for this rule is that one of our critical issues of our healthcare system is that people cannot easily access their health information in an interoperable form, meaning seeing different providers, insurance, everything all in one place, or easy to look at all of it. And CMS believes that patients should have this ability to move from payer to payer, provider to provider, and see all of your clinical and your administrative information, like claims, all together in one place. And so that's why they've created this rule. It's addressed to payers, providers, and vendors or developers. So each of us have our own little sections. And what I'm going to go over today is the part that is directed at providers. And a provider can be a hospital or an individual physician. It's like a broad term. So as I say, providers, whatever your facility is, know that you're probably covered in that. So the goal of the law or rule is to empower patients to make better decisions. And this rule works in tandem with the 21st Century Cures Act. The reason I made that point is because that 21st Century Cures Act is a big law that is very impactful to technology, to health IT, especially as vendors. So these two laws together are going to change the technology landscape a lot. So then, excuse me, there are several new policies. I would like to discuss 4 of those today: patient access, provider directory, public reporting and information blocking, and digital contact information. And these new policies came about as a result of Trump's My Healthy Data initiative. And if you want to learn more about that Healthy Data initiative, there's a link on the last slide in the deck, and you can go out and read all about that. Like I said, these are not all of the new policies, but they're the ones that most directly affect providers. The other ones affect payers the most. So you can look those up if you want to know what the payers have to do. So the first new policy that we'll talk about is patient access. And this one is requiring payers to allow patients basically to have a patient portal for insurance. And I know a lot of insurance companies you can log into now, but they're going to have to make it even easier for you to get to, for our client patients to get to that information. The data will have to go back to January 1st of 2016, so it'll be 4 years worth of data. And it has to be, this one is a real surprise. It has to be available no later than 1 business day after the claim is adjudicated. So that's, that's a pretty fast turnaround. Also, patients are going to know when you submit your claims, so that could be very impactful to some people. This one, this new policy begins on January 1st of 2021. However, they're encouraging payers to go ahead and implement this earlier, so you might start hearing about it by the end of the year. The next one, the Provider Directory API. This is about CMS regulated payers, like Medicare Advantage, CHIP, all of the payers that CMS has control over. And they have to make a provider directory publicly available by January 1st of 2021. So this is that direct address for sending summaries of care and transitions of care to other hospitals or doctors electronically. That's what they're talking about. And I think everybody's been waiting for this for a very long time. So that's going to be there, that's the biggest one, I think. That'll be a huge impact, a very positive impact. Excuse me. So the next one is on information blocking. And it says public reporting and information blocking because if you have ever submitted promoting interoperability measures or meaningful use measures, there's a place where it asks you, do you agree to not block information? And if you click no to that answer, then there'll be a check mark by your provider's name in Physician Compare or Hospital Compare. So, so if you don't know what information blocking is, once again, there's a link at the end of the slide, or you're welcome to give us a call and, I can go over that with you in more detail. So the next one is the digital contact information. And this actually ties back into the list or the directory. So the way that CMS or the payers, however you want to refer to them, will be able to public report your direct address is because you're going to need to provide it to them. And here's another place that they will publicly report on Physician Compare and Hospital Compare. If you do not update your digital contact information, then they're going to call you out basically on the public website. So you're, anybody in the community can go there and look at your quality measures or whatever and see that you aren't participating in this. So out of all of those things, those 4 things, you're probably thinking, okay, well, what do I need to do? For the patient access, this is just an awareness that patients will have online access to their insurance claims and encounter info, including costs, in a much more transparent, easier, available way. So, when they come in and start talking to you about it, you won't be caught off guard. For the next one, for the provider directory, this is the one third-party application developers such as EHR vendors will be able to access the provider directory from the payers. So that's how we, as an EHR vendor, will get those addresses from the payers and make it so that you can choose and find the direct address for the provider that you want to send your info to. Now, as far as getting your, I'm sorry, skip, I was jumping ahead a slide. So what you need to do about the information blocking is to make sure that you understand what it is and then answer yes to the question when you attest to your PI measure. So this is a once a year thing, but it is important that you know what information blocking is. What do you need to do about digital contact information? You need to ask all of your vendors to send you their digital contact information, or send your digital contact information with them. And you have to send that up into the NPPES, DIPS website, that's a CMS website, and that's where the payers will get it from. So Azalea will be doing this sometime in the third quarter. We're gathering all that information so we can send it out to you, but you're welcome to contact us if you need it before. Just remember to get it set up in here so that you don't get dinged and get a check mark by your name. All right, there are the rules. The links to the rule. This is the final rule. This is the announcement about this rule. This one's a fact sheet about this rule. And then here's info about the Healthy Data Initiative. And so that's about all I have. I think we're ready to go to Q&A.
All right, thank you, Margaret. Yes, we are now going to answer questions submitted during today's presentation. And as a reminder, you can still submit your questions in the questions pane on the attendee control panel. So our first question asks, what is an API?
An API is like a patient portal or an easy way to access your data. So I'm not going to get into the technical terms of what it is, but it's basically a patient portal.
All right. Thank you for answering that. Our next question is, when will we be able to use the provider directory?
So the law dictates that the provider directory be available January 1st, 2021. However, they are encouraging vendors and payers to have that up and running as soon as possible. So hopefully by the end of 2020, you'll start to see that.
All right. And we have one more question here. What is my healthy data?
So that is, like I said, that's an initiative from President Trump, and it was kind of like a precursor to this law, was where they were saying everybody needs to have information to their data, and they're building a platform. CMS is building a platform to get all of that data in one place. And it will work with payers, it'll work with the HR vendors, so that you can see everything all at once, your claims, your prescriptions, your clinical information for multiple providers.
All right, thank you for sharing that. We have one more question here. Who is going to pay for this cost if there's cost related?
So there will not be any direct cost for the provider. This is going to be on the vendors just in their normal development cycle for keeping up with new laws, and also the same with the payers. So we budget for new rules every year, and I'm sure payers do too. So there won't be any charges for this to our clients.
All right, that's great to hear. We don't have any more questions at this time. Let's wait just a few more seconds here, just in case we get an additional question submitted. And while we wait to see, Margaret, is there anything else that you would like to add? Any common other questions that you have received on this topic?
I'm trying to think of what I might have heard. I think probably the most confusing part is that it's only CMS payers, only the payers that CMS has control of. So it isn't. I think that commercial payers will have to do this just to compete, but they aren't required by law. For the CMS payers are required by law to do this.
Great. All right. Well, it doesn't look like we are getting any additional questions so far. So we will go ahead and conclude today's webinar. I want to thank everyone for attending, and a special thanks to Margaret. As a reminder, the presentation will be shared in a follow-up email, which will also include a link to the recording if you want to review again or share with any of your peers. On behalf of Azalea Health and our presenter, thank you for joining us, and have a great rest of your day.
Thanks, Ellen.